Okay, we're back, and we're going to talk about alternative ways of using cannabis medicinally. And first thing I'd like to talk to you about is the one that a lot of people know, and that's butter.
But
Now, yep,
butter like
as in
dairy
with two T's.
with two T's. Okay, that
Okay.
kind of butter.
um, Now I know there's different ways of making butter. Some people like to make it with water. Some people make it without water. Is there a preference that you find through the Compassion Club or through talking with people that the way people like to make it?
There's like two, like you said, there's two principal ways of doing it with butter at least. Us, our society, we don't use the water method. Some people do. We don't have space in our freezer to do the separation part of that process.
Yeah.
But I'll elaborate on them. I mean, there's one method where you get a big pot of water, you add the butter and the cannabis and the water together, and you boil it, and then you strain off the cannabis, and then you freeze the mixture afterwards to separate the oil and water, and then sort of like scoop off the butter. And that way requires a lot of space in the freezer. Another way to do it is to put it in a slow cooker on a low temperature for at least 6 hours. Some people do it for up to a day. Some people do it for a long, long time, but we don't do it for longer than 24 hours, and then just strain it off with a cheesecloth kind of thing. So, but dairy butter is not the only fat that you can use. You can use any sort of vegetable oil. You can use coconut oil, olive oil, canola, almond, cannabis and cannabinoids can be extracted into fats and alcohol. So yeah, but
What
that,
about what about milk? What
I
about
so just to go back to the like boiling water with a slow cooker. You'll make potent butter either way. Like it really depends on the quantity and the quality of the starting ingredients.
correct? Yep,
Which method you use, both work. You know.
correct, correct. A lot of people know about making brownies and cookies when they make the butter. Is there any other food item that you might see it's popular amongst the patients?
Brownies are our most popular item by far. We try to cater to people with special dietary restrictions. The thing with medicating with edibles like brownies and cookies that we're finding,
Yeah.
and go figure. But you need to some people need to watch their intake of them because of the other ingredients like sugar and the fat and all of that stuff. So we've also been working on making less caloric. But regardless, the brownies are still the most popular item
That,
around. We make cookies and candies, but we really focus on making strain specific and concentration specific products because what when you eat cannabis, it's metabolized by your body, and so the effects tend to be longer lasting. They tend to be more psychoactive, and the risk of having an adverse reaction is higher when you eat it than when you smoke it. So it's easier to control your dose as well when with inhalation, with smoking.
right.
So it's a bit trickier with edibles because they take longer to take effect as well, right? So it's
Right.
very important that patients be cautious when they try edibles for the first time, especially if they're inexperienced with edibles. But it's always good to take a small bite or a small bit of an edible before you take the whole thing, and you got to wait at least 1 or 2 hours after taking that little bite, and to assess your mental and physical state
Correct.
before continuing. So we make all of the edibles that we make are strain specific. So we make sativa stuff, indica stuff. We make things with Jean-Guy and chemo and special kush and purple kush. All of our edibles are labeled as such. And in addition to being strain specific, they're also concentration specific. So we have
Oh.
mild dose items, and we have very strong dosed items, depending on what the patient needs and their experience level and so forth. So
I was going to mention not everybody can can use butter because of, you mentioned the cholesterol end of it. Is there anything that people can use that's not high in cholesterol?
Yeah, so coconut oil is good. You can also make a tincture. You can extract it in alcohols or glycerin.
Yeah,
You
yeah.
can make little gelatin capsules.
We're gonna get into some of that stuff here in a second.
But yeah, it's not just cannabis butter. It's not just
Right.
dairy butter dairy butter is not the only fat that you can use for cooking cannabis.
One last question on the cooking end of it. It's sort of something that I've seen over the years, and that's the. I don't know if you actually do the actual baking or how much baking you actually do, but some people talk about the temperature of the oven. Some people say that it should be like 250 degrees. Some people say just cook it whatever temperature you want. Some people say, well, if you cook it too hot, then you're gonna break down the cannabinoids and it's not gonna be as effective. And
We haven't really found that. I mean, like, I suppose technically that's true. You don't want to like go above a certain. You don't want to like roast your stuff. But I mean, like most baked goods are baked at 350 degrees Fahrenheit, which is actually around the vaporization temperature of cannabinoids. But clearly, we would have received some negative feedback by now if we were cooking off the cannabinoids and affecting the potency. I think that's sort of an overblown thing. I mean, you don't want to cook it too hot. You don't want to be like broiling something.
Right.
And you also may want to decarboxylate your starting material before you put it into the butter, which means toasting it at around 300 degrees in the oven for just a couple minutes till you see the first signs of vapor or smoke.
Right.
That will activate. Basically, THC is present. THC and other cannabinoids are present as acids in the plant.
Yep.
So you want to heat that up to remove the carboxyl molecules from
now,
the
with that, is it just not if you don't do that beforehand and you just go ahead and bake with it, is it not decarbolizing as much if it's already in the food product versus being out of the food product?
Some of it, it's like we've only noticed a marginal difference in potency because but I think that a lot of the cannabis will decarboxylate during the cooking process as well, like during the infusion process, especially if you're leaving it in a slow cooker for a day. I think that you have like a slow conversion effect. But either way, it's a minimal difference. But
It's a minimal difference. Okay, we're gonna move on to tinctures here.
Okay.
I know of two ways, not just the glycerin and with the alcohol, and on the video that we watched, they talked about that as well. Now, there's also, I understand, there's a cold method and a hot method of doing these. Hearing any preference on the way that people prefer to do this, prefer to make it?
With tinctures, it's actually especially important to decarboxylate the cannabis, especially if you're going to use a cold method, just like keeping it in the keeping a dark spot. With tincture, you soak cannabis and alcohol in a jar or something, keep it in a dark place, and shake it up every once in a while to make sure it's still getting soaked. But you want to soak it. It's like a long soak. You want to soak it in the alcohol for a few weeks, at least 3 weeks.
At least 3 weeks.
You can also make a tincture with glycerin. You can heat cannabis in glycerin and extract it. It speeds up the extraction process into glycerin. When you do that, you want to be very careful because glycerin retains heat for a long, long time. So if you heat it up, it holds that heat. So
Okay.
So water cools down faster than glycerin does. So be careful if you do that. But
yeah, because I've seen people talk like online. They're heating glycerin and cannabis in a slow cooker to do this.
Yep.
On a real low temperature. So
that's a great way for people to ingest cannabinoids because like I was saying, some people don't want the calories from eating brownies. Some people are very sensitive to alcohol in tincture. So glycerin is a great non-alcohol, non-fat method of ingesting it. But one thing to keep in mind, no matter what you're making, whether it's cannabis butter or coconut oil or a tincture, you want to be make sure you write down and keep track of how many grams of cannabis are going into however many liters or grams of oil or coconut or alcohol, because that's how you can determine. That's how you can get an idea of how much cannabis is in each serving or each 30 milliliters of alcohol or so forth.
That way, you know your dosage and you're controlling your dose.
Exactly, because I mean everybody's heard the story of the brave soul who goes to a party and eats 3 cannabis muffins or something and ends up having a very panicky reaction or whatever. You want to know how many equivalent grams are in each serving per se. So when we make any of our edibles, it's in standardized quantities and standardized ratios, so that every cup of butter has the same amount of cannabis, and so then accordingly every cookie or every brownie or every bottle of tincture has the same amount of cannabis. Helps consistency is very important.
Now, if you're going to do the cold method and you're going to soak the cannabis, I guess soaking the cannabis in the alcohol or the glycerin basically about the same amount of time would be required.
You know, to be honest, I couldn't tell you about the glycerin. I would actually assume that it would take a bit longer if you're going to do a cold soak in glycerin, because it's a really thick, sappy, gooey substance. It doesn't saturate like alcohol does as quickly. Yeah. I've never done soap with glycerin, to be honest. I've only done it with alcohol, and we use 94% alcohol here.
In the video we were watching, the fellow was talking about with these tinctures that people can use it at, you can use it in your coffees or as a sweetener and stuff. But they also talked about using it as a mouthwash.
Yeah.
And actually even mentioned about putting it in your bath water.
Bathwater.
I've never heard of that, but
I haven't heard about bathwater, but mouthwash I do. I actually recommend that to people all the time, because we make our tincture with 94% alcohol. Okay, so 94% alcohol, you can't just drop this stuff on your tongue. You can't just spray it in your mouth because it just roasts your taste buds. So this is tincture that's really meant to be put into a glass of water or a tea or a coffee. But what you can do is you can take a small little glass of water and you can add your tincture dose, and you can take it and you can rinse it around like a mouthwash for a couple of minutes, and which allows the cannabinoids to soak in through your saliva glands, and that takes effect slower than inhalation, but faster than like ingestion. It's somewhere between smoking and eating it in terms of speed of onset. So if you've heard about taking it as a mouthwash, that's the idea behind it, is that it'll absorb through your saliva glands and take effect a bit sooner.
okay. Just going to take another commercial break here. We'll be right back.